So today what we're going to talk about is herbal safety, and this overlaps with a few other little topics as well. So we're going to discuss basically some different types of risks that exist, how herbs can be contaminated with things, and this may not be a safety concern, but it is can be irritating if your herbal product's not what it's supposed to be. We'll talk a little bit about drug metabolism, some common adverse reactions, drug interactions, and then a little thing on some herbs that are safe and not safe during pregnancy. So this little table here is a little outdated, but what I like about it, I think it was done in 2000 or 2002. And so these are the top most commonly sold herbs at that point in time. And I think it's probably changed significantly since then, but at least these ones are probably going to be at least in the top 20. So when you look at these things, you've probably heard of a lot of these. Echinacea, ginseng, ginkgo, garlic, St. John's wort, peppermint, ginger, soy, chamomile, kava kava. So all these herbs that are mentioned are used for a variety of conditions. Some of the evidence is inconclusive. I'd say in the past 20 years or so, or 18 years since this has occurred, I would say that the data has probably changed, and a lot of these are looking more effective. Certainly chamomile's got some more research out on that. The take home with the top 10 herbs that people are consuming, if you look at the list of side effects associated with it, they're pretty much non-existent or very minimal, and probably pretty rare. Okay, and so the nice thing about herbs is whether or not they're effective, you can argue that based on the science or whether or not there's sufficient evidence that exists. I can say with confidence that most of the herbs that we're using are safe when used within the therapeutic range. And there's going to be a few exceptions that we're going to talk about, but I'm not overly paranoid about the herbs that we use in practice. That being said, there are some very toxic and poisonous herbs that you need to respect, and certainly ones that we don't use in practice very often. There are some that can result in death pretty easily, so you have to be careful. So I think you guys have probably heard the Hippocratic Oath, first do no harm. Now, the reason why I brought this up is what is harm, and then sort of what does that mean, and first do no harm. This can be open to interpretation. I think medical doctors, naturopaths, any healthcare provider would agree that you don't want to cause harm to your patient. But this gets a little bit complicated because there are cases where you may be giving a substance that could cause harm, but it will also help save the person's life. I mean, everything has side effects. Everything has a risk associated with it. So there are extreme cases, let's say chemotherapy, where that drug can actually help put the cancer in remission and can actually help extend people's life, because if they didn't take it, they may succumb to the cancer really early. So in that case, there's side effects from taking the drug, but you have to weigh that out. What are the risks of actually dying from the disease itself? There's other cases where there is no benefit in taking, let's say, an antibiotic if you have the common cold. And so in that case, that's sort of just a waste, and is harmful indirectly because it contributes to antibiotic resistance. There could be side effects as well from it. You're messing up gut flora. So there are harms in that, and there's no benefit. So that one doesn't even make any sense. Now, there are other types of risks as well. We'll go through this. So mild side effects are some examples. And this might be just a little bloating and gas. that's not really that harmful. So we're not going to worry too much about that. Now, serious side effects, as I mentioned, with certain drugs like chemotherapeutic agents, you have to weigh the damage that these drugs have with the benefits of taking them. And there are cases where, for example, if you had breast cancer, and there was a case where I saw of a patient where she had breast cancer. She'd already gone through chemo. She had gone through surgery, and her doctor had recommended her go on a long-term anti-estrogenic drug to prevent recurrence. And she seemed kind of low risk to me. And the problem with these medications, it caused a lot of side effects. She's in pain for the last 5 years and other symptoms, and felt awful. And her doctor basically told her that she had to be on these drugs, otherwise the cancer would probably return. And I don't know anything about that drug, but when I was speaking to the patient, I said, okay, well, why don't you go and ask your oncologist, or him, I think it was, what is the number needed to treat? And you'll learn this in statistics if you're not learning it already. And this is an important thing to understand, is that it really tells you how effective these drugs are. And so if you give the drug to 100 people, how many of those 100 people are going to get the benefits from that particular drug? And because I didn't want to tell her she shouldn't take the drug, I just said, let's find out what the numbers are on it. And when she went back to her doctor and asked the team of oncologists, said, well, what's the number needed to treat from you being on this drug? And they all kind of looked at each other and got discouraged and sort of looked a little awkward. And they said, well, we'll have to go and look at the number. We'll be back. And about 45 minutes later, they came back and they said, okay, well, the number needed to treat is 190, I think it was. And so the patient's like, so what you're telling me is that 1 in 190 people are going to benefit from this drug, and it's going to help prevent breast cancer. And they said, yeah. And she said, so what you're telling me is that there's basically a 1 in 89 chance that this drug is going to do nothing for me. And they said, yeah. And she said, well, I've been experiencing serious side effects for the past 5 years that are greatly affecting my quality of life, and I'm miserable. Do you really think I should be on this drug? And they all kind of looked at her and said, no. And they changed their mind. And so after her doctor kind of threatening her that if she didn't stay on this drug, she'd get cancer, I mean, that's not really the case. And so it's all about understanding numbers. And so in this woman, she went off the drug. She's feeling much better. Her life's better. She's happy. And we'll never know probably if that drug was going to help her or not. But, less than 1% chance is not very good, if you ask me. So serious side effects make sense if you're kind of at risk of dying, like if you have HIV and going on the medication, antiretroviral drugs for HIV. They have serious side effects, but they do help prolong life. So that's something where, if you're looking at the types of harm, I would say those harms are worth it. Overdose is another thing. So you might have a safe drug. For example, Tylenol is a very safe drug when taken in the recommended range, or more or less. But if you exceed that range, it becomes lethal. And so overdose is another thing where it's harmless at small dose, but very, very poisonous at high dose. Another risk that can happen is that you could develop, there could be harm caused by, or toxicity caused by, not the herb itself or the drug, but some kind of contaminant in it, inside the herbal preparation. And that could be, there's a few different types. It could be the wrong herb, or it could be something that was added in by mistake or intentionally. So that's something to look for. We'll talk about that later on. Also, drug interactions, where you could have two completely safe things, like a safe drug and a safe herb, but when given together, they cause harm, where there's like this synergy sort of effect in a negative way. And we'll talk about those later on. There's concerns related to pregnancy, where maybe the drug or herb is safe to give to the mother, but is very damaging or toxic to a growing fetus or to an infant that's nursing. There's also the risk of, I think I mentioned earlier on, causing the harm by making a drug ineffective. So if you take something for a long enough time and if you don't need it, maybe your body becomes resistant to it, or maybe by overuse of antibiotics in farming and in healthcare, and given preventatively to people and animals unnecessarily, could mean that these powerful drugs are no longer powerful. And the final way that you can cause harm, which I think this is probably one of the areas that naturopaths are most likely to cause patients, is not by giving something that's harmful, but by giving something that's ineffective. And there's a serious, it's a serious disease like meningitis or cancer or infections or whatever it may be. So they give an ineffective treatment when a effective treatment existed. So there are certain things that if you don't act fast enough, you could cause harm. And I'll give you a few cases of this. And I think this is really important. So here's an example of two parents out in Alberta, I believe, who had good intentions and wanted to use natural therapies because they believed that those natural therapies were good for good for the child, and it was in line with their beliefs. But it turned out in this one particular case that these parents, their child had contracted meningitis, and they didn't take the warning signs serious enough, and they just assumed the child would get better. And they did take them to a naturopath, but not as a patient. They walked into the clinic saying, "Oh, do you have any herbal remedies to treat a viral infection?" But they never consulted with a naturopath. And in the end, the child died because the parents didn't take the child to the hospital fast enough. And so this was all over the newspapers and the media, and the Canadian Association of Naturopathic Doctors had to make a statement on it. So in this case, the naturopath did nothing wrong because he never technically saw the patients, only the receptionist did. They did buy something at the clinic, but that's no different than buying a supplement or some kind of drug at the pharmacy below the medical doctor's office in some ways. But anyway, so here's an example where had they have taken the child to the hospital or to a medical doctor, they may have been able to help that child. And also, even if they saw the naturopath in this case, I suspect the naturopath would have recommended they go to emergency. And I think in the case, actually, the receptionist told them that if they had a serious thing, they need to take the child to emergency. But anyways, here's another example. Homeopathy is certainly getting a lot of flack these days from the scientific community. And it's definitely creating a rift within our profession. Lots of old school naturopaths love it. The newer generation seems to not want to be associated with it. There may be some benefit to it. I'm not saying there is. I'm saying there may be some benefit of doing it. But I stay clear of it because of the controversy. I don't want to be associated with it. But I do have a few issues with homeopathy. And one issue that I do have with it is that a lot of homeopaths, I'm not talking about just some naturopath who uses a little bit of homeopathy in practice. I'm saying people who use a lot of homeopathy in practice or also claim to be homeopaths. It's almost like a religion, and it's a bit of a radical approach to medicine where it's faith-driven because the evidence is not supporting it from a scientific published data. And they have arguments of why you can't use science to prove homeopathy. I'm not even going to go there. But there are cases of it causing harm. Now, some homeopaths believe that drugs are really harmful and that even some natural therapies. I remember there's a homeopath who once worked at the college who thought that naturopathic treatments could be suppressive and could could cause harm to patients if used incorrectly, and I'm not sure about that. But anyways, where I see you could cause harm is if a patient came in and you thought that you just have to find the right remedy and give it to the person and they'll get better. That's the belief, and certainly that doesn't always happen. Now appreciate that placebo is a powerful thing, and there will be cases where giving any kind of treatment, whether it's homeopathy or a herb or even a placebo, the patient will get better. Because don't forget, patients, I guarantee you, a patient will always get better. Well, it could get better, could get worse, or could get the same, or could stay the same. But eventually, their condition will change, and it may have nothing to do with what you do. So when it comes to homeopathy, it's hard for me to believe that getting the right remedy will cure someone of HIV. And there are people making claims like that, or that it can treat cancer and cure cancer. And I really see this as being very dangerous. And another area where I see it being dangerous is using homeopathy instead of vaccinating children, or instead of taking certain drugs that, like anti-malarial pills that could be prophylactically given to help prevent getting some type of infectious disease. Now, this isn't just my opinion. There is an article where there were 3 different cases in Europe where people saw a homeopath, and the homeopath recommended a homeopathic remedy to be given prophylactically to prevent the malaria. And we know that in this, I can't remember in this case if there's 3 cases or if it's just a 1 case. This is maybe just 1 case, but I've heard of other cases since then. And so the patient took the remedy. A homeopath could argue, well, it wasn't the right remedy. Regardless, the patient took the remedy, didn't take the anti-malarials, went into the heart of Africa, contracted malaria, and ended up getting multi-organ system failure and had to be in ICU for 2 months because she got malaria. And one of the damages in this case that I can see is if you take a remedy that you think is going to protect you, you're more likely to engage in risky behavior. So if you take some let's say some supplement that's going to prevent lung cancer, or that you believe is, and let's say it does nothing, because you think you're protected, you're more likely to smoke more. Or because you've taken a homeopathic remedy, the harm with that is, 1, you don't have the protection, but 2, you might just be a little more careless about your mosquito repellent and your mosquito net, and it could increase your risk of actually getting this. Now, just as an aside, I've been down in the Amazon, I don't know how many times now, 4 or 5 times, and I've been to Southeast Asia a few times, and I've only taken anti-malarial drugs prophylactically once and all that, because the first time I had a bad reaction to it, and I decided not to take it. And I've made that calculated, risk decision based on the fact that I'm going to areas where I'm only going to be 6 hours away from an airport in case I get into trouble. I'll always be within 6 hours of a hospital if I get into trouble. And the regions that I'm going in, even though it may be high risk when you're looking at it from Canada, in those areas, when you speak to the local people and some of the local doctors, it's not really the high risk zones for the Amazon and for other places I've traveled. So, and if I got malaria, well, I take the treatment, I would deal with it. But so I'm not saying there's anything wrong with choosing not to take the anti-malarials, but it is my choice, and I understand my risks. Okay. Do you guys have sound? I don't know how long I've been talking for without sound, or if I've had sound. So this could just be one person. Nothing like the wind to rattle a few internet fibers or whatever it is. And here's another thing that I'm particularly concerned with is right now there's a measles outbreaks around the world, and this is going to happen relatively quickly. I mean, there's been a few cases in the summertime, but we've got some cases in Canada now, and the major reason why there's measles outbreaks right now is because people aren't vaccinating their children, and so this is a big risk. And why this bothers me is my son, who's 10 months old, he can't get the measles vaccination, and he's scheduled to get it at 1 year, so he hasn't received his measles vaccination yet. And it wasn't really a concern until a couple of weeks ago. I heard there was an outbreak at Pearson Airport, and we're planning on going on Mexico next week. So Mexico, in the area we're going at, there's no measles outbreaks. There's none in Guelph, but it could just be we go through the airport and there is that small chance that someone from Europe or one of the higher risk areas where they have had an outbreak could go through Pearson's and drink from the same water fountain or whatever. So I'm a little paranoid about this. I tried to get my son vaccinated before going down, but for a number of reasons, the one clinic couldn't do it, and they were booked up because it was kind of last minute. I wasn't concerned about it until last week. So hopefully he's fine, but you can appreciate back about 15 years ago when I was a student, a lot of naturopaths were anti-vaccinations for whatever reason. I think there's a lot of misinformation, but one of the challenges now is that there's now a critical mass of people that aren't vaccinated. So now the herd, which means the entire population, could be affected. So, and now my son's at risk because of bad decisions that people made, 10 years ago, or more. So, anyways, so these are real risks. So however you feel about these topics, just appreciate there are risks associated with it. You can cause harm. But yes, there is potential harm from getting a vaccination. I think it's relatively small, but there is harm. But there is also harm that can occur if you don't do that treatment. So anyway, so that's more of a philosophical sort of debate. I'm not trying to force you guys into believing one thing or the next, but there's certainly some good evidence emerging. And whether it's homeopathy or herbal medicine, it's the same thing. There are herbs you can give for measles, but I think the best medicine is prevention in this case, right? So, any questions on that before I move on to the next topic? What do you guys think about that? Those concepts of harm. Do you have any thoughts? Is it interesting? I don't want it to be too opinionated. I hope I'm not rubbing anyone the wrong way. Because certainly I'm not trying to get up on a soapbox and thrust my opinions on you. I'm just giving you some, make up your own mind about things, but just definitely be intelligent about it. So when it comes to herbal medicine, some things to be aware of is that some herbs are contaminated or adulterated with things that you don't want. And so sometimes these things can cause problems. To give you an example, one of the first things is that herbs are plants, and let's face it, the natural world is not clean and not sterile. So there is a risk of getting bacteria or probably even viruses contaminating some kind of plant material, and that could be romaine lettuce from your grocery store, or it could be, let's say, chamomile tea or some other herbal product that you buy somewhere. One thing, so to give you an example, I remember I went to Chinatown when I was living in Toronto, and I like buying certain things from Chinatown. I remember seeing goji berries, wolfberries for sale there, and they were about a fifth of the price of what I paid for them at the grocery store. And I was thinking, oh, this is fantastic. They're so cheap. And so I bought some, and then I was eating them on the way home like I normally would. And I don't know how much longer later on, but basically after several hours, or maybe the next day, or that later on in the day, I ended up basically getting like traveler's diarrhea, and hadn't even left the country. So, and when I looked at the package, it said right on it, must be boiled before consuming, because normally they add them to decoctions to as part of a herbal remedy, herbal combination. And so in this case, the goji berries coming from China, who knows, how they were grown, how they were handled, transported. They may have used, human feces as a fertilizer. We don't know. And whatever the issue was, there's definitely some kind of bugs on it that made me sick. And so boiling it probably would have helped, but it sort of made me a little bit more suspicious of these things. Certainly, I have more of a concern of herbal products coming out of China than probably any other country, to be honest with you. Now, so there is one example. Another example is that, let's say you might have some herbal product that you gather, and it might be that there's no bugs living on it, because maybe it's been boiled or made into a tincture or something that may have killed the bugs in it. But there could be some kind of toxin that was produced by a bug that still is present. So in the case of, let's say, aflatoxins, we've already talked about those earlier on, where the fungus aspergillus will grow on a grain or a rice or a peanut or whatever it is. And even if those peanuts are roasted, that would kill the fungus, but these aflatoxins would still remain and could cause problems. So another example would be some of the cyanobacteria produce pretty nasty toxins, and this could be something that could contaminate, more so I would think, with water-based, if you're eating like some kind of seaweed or something like that, but that's another example. With regards to contaminants, chemicals, obviously, there have been cases of Chinese patents having actual prescription drugs added to them. And so you buy a herbal complex, and let's say one for low libido, and then it turns out there's some Viagra slipped in there. And I'm not opposed to, integrating pharmaceuticals and herbs. I mean, there may be a place for that. However, you need to label it. And the biggest problem is that these Chinese manufacturers weren't actually labeling that there is Viagra in their herbal products. So the harm that can cause is if you had if you suffer from angina and you were taking what do you call it? Nitroglycerin, and you're on Viagra at the same time, that could be a very lethal, or I think that could be a very serious, maybe lethal drug-herb interaction, for example, or drug-drug interaction. So that would be a bad thing. Sometimes dyes are added to things, and again, that may not be something you want in there. Could be dyes that are labeled, or it could be unlabeled, depending on where things are manufactured. Preservatives could be a potential issue. Another thing I'd be concerned with is pesticide residues. Let's say you go and have a nice cup of chamomile tea thinking it's healthy for you and good for you, and meanwhile it's been sprayed with herbicides. So when you make your tea, you're basically getting all those herbicides are going into your tea and you're drinking it. I would be concerned about that. Also, depending on some manufacturing processes, there could be small amounts of solvents remaining in the final herbal capsule or product or whatever it is that might be an issue for some people. Finally, when we're talking about adulteration of plant material, there's different ways that you could have the wrong plant in your herbal preparations. And so the one thing is, let's say you may want to have ginseng root as the thing that you want, and ginseng root's very expensive. And it might be that in China they're selling, or Korea they're selling ginseng leaf and flowers for $1 a pound, while ginseng roots, $200 a pound. And so a manufacturer could say, well, let's just package up the leaf and put it in capsules and sell that. And you get a pill that's 1 gram or 1,000 milligrams of ginseng. It doesn't distinguish whether it's the root or the leaves. And you buy it because it's half the price. Turns out that probably wouldn't do very much if you're eating ginseng leaves. It might do a little bit, but very, very little. And so with every herb, there's a certain part of the plant that's the right plant. It's no different than if you wanted to buy an orange, and if instead of selling the fruit, they were selling the leaves from the plant or the bark from the tree. And you could see, like, if you're eating bark or trying to make orange juice out of the bark or the leaves, it's just not going to be the same as making it from the fruit. And in a lot of ways, that example is no less ridiculous than what some of these herbal manufacturers have done in the past, using the wrong part of the plant. And in a lot of cases, it could be that using the wrong part of the plant just is a waste. It's just you're producing an ineffective product that doesn't really work. There's other cases where you could actually be causing harm because there are different phytochemicals and there's different things in the leaf than there would be in the root, or in the flower than the leaf. And so it's important that if in herbal medicine, and remember, like even with the example of aloe vera, the gel from the leaf has totally different phytochemicals than the inner leaf, which contains a resin. And so we'll talk about that in another lecture. So appreciate, here you've actually got, they're both good herbs, but they're completely different in their phytochemicals and their indications. They're both safe, relatively speaking, but still you don't want to use the aloe resin for the same purposes as the inner leaf. Now, sometimes you can get certain herbs. There could be different genus and species. Like there's different varieties of plants. So there, I'm trying to look at what I wrote here. Correct genus and species, but less active subspecies. Well, that wouldn't necessarily be an adulteration. I don't really like that example. I don't know why I wrote it down that way. But I think what I was trying to say is, appreciate you going by. Well, no, actually, that would still be adulteration. Sorry. You could look at, for example, grapevines. And certainly it happens in Italy where you could have the same genus and species for the grape, and the variety could be the Brunello, or the different types of grapes that are used to make Amarones. I don't remember what they're all called. And we know that in Italy, the mafia's got their hands in everything, and one of them is one, they adulterate the olive oil with canola oil, and two, they adulterate wines that are labeled Brunellos. They'll actually add grapes that aren't technically Brunellos, and they're not actually from the same group. So I can still sell it for that, but it's not actually that. So that would be an example where the species and genus and species is right, but you're not getting the same variety. So that would apply with wines, and certainly with, I would say, with another example that might be is like ginseng roots. You may buy ginseng and you're paying a premium for 10-year-old ginseng roots, but maybe the ones that they've ground up and put into powder is only actually 1-year-old roots or 2-year-old roots or whatever it is. Or you think you're buying ones that are wildcrafted, but they're actually grown in fields. So there's different ways that you could have adulterations. There are a number of other ways where sometimes I've seen this. There's some reports, this we'll get to in a second, where you buy a plant, you think you're buying a particular, let's say there's different species of ginseng. So there's like Panax ginseng, Panax quinquefolium, Panax nodo ginseng. I think there's one, Panax japonis, one that grows in Japan, something like that anyways. So there's at least 5 or 6 different species of ginseng that are commercially available that I know of. And one of the things that could end up happening is that you think you're getting Panax ginseng, which is the Asian or Korean ginseng, but maybe they're selling you Panax quinquefolium, which is North American ginseng, which still works, but it's not as stimulating and not as desirable, and certainly a lot less expensive. But then there's also problems that you think you're buying the same plant, and in some cases, if you get the wrong species, it could be ineffective or it could be dangerous. And then there's some cases where they completely messed up. They got the entirely wrong plant, nothing related to what the desirable one is, because the genus and species is totally wrong. So I'm going to give you a couple examples of adulterations that we've heard about and that are well known and published. So kava. I love this herb. This is a herb used in Polynesia for thousands of years. And they consume it. It's like I don't know if it's sacred, but they use it in rituals and ceremonies for social events when they're welcoming people into the community. Instead of smoking marijuana or drinking alcohol, they'll use kava. And so kava is ground up, and there's a traditional way of preparing the roots. And they sit around, they drink cups of this, and it's an intoxicant. And in higher amounts, it acts as a social lubricant. It makes your body relax, it makes your mind relax, but it doesn't cause the same type of mental impairment that you would get from, let's say, drinking alcohol or even with smoking marijuana. And so the main way that it works is it works on the GABA system. So the GABA system is related to drugs like, for example, Valium, which are benzodiazepines. It has that effect on the benzodiazepines and the GABA receptors, and to have basically a calming effect, and maybe even a little bit of lucid dreams with it afterwards. It's a great herb. It's been used for thousands of years over there. It seems safe. There's a few case reports, and if you take too much of it, you can get a little bit of a kava rash to call it, but pretty uncommon. But back, I think it was the late 1990s, there were a number of case reports worldwide of people consuming kava and developing liver problems. And this occurred in a few different places. And I don't think it was that many cases. I don't remember the precise number, but more than 10, but less than 100, okay? And I think it's a dozen or 24 cases. I don't remember precisely. And what ended up happening is because of these cases of people consuming kava getting this drug-induced hepatitis, it was basically banned from a whole bunch of countries around the world. And now I think it's always important to investigate when there's something happens and somebody ends up getting sick. We got to figure out what's going on there. And even if it's only a dozen people, it's still worth investigating. But there's definitely a bias against herbal products when we compare that to Tylenol, and we'll come back to Tylenol later on. Tylenol is the #1 cause of liver transplants in North America. Yet, few people realize this, and the number of deaths from kava every year, I don't think anyone's died from kava, but it was banned by however many countries. Tylenol results in death in a lot of people. I don't know the numbers, but it's the #1 cause of liver transplants in North America, and people die from it every year due to accidental or deliberate poisoning. Yet it's still legal and no one knows about it, knows how serious these risks are. So it seems a little unfair. But anyways, going back to the kava mystery, eventually the ban was lifted in 2014 in Canada. So it's available. I've used it with patients. I've used it at home. It's definitely a useful herb. And what we suspect as being the possible cause for this liver problems it might be that some of the extraction processes were different than they used traditionally, and they were using some weird organic solvents that may have been contaminated with that, or that depending on the type of solvent they used, it may have extracted certain compounds in high amounts that aren't normally extracted when they used conventional or traditional preparations. It's also possible that maybe there was a batch that got stored in a humid environment where maybe the roots weren't dried properly or whatever it is, and the aspergillus fungus grew on it, and there's some aflatoxins on there. That certainly is a possibility. And there's also the other fact that we know that the aerial parts appear to contain the pyrrolizidine alkaloids we talked about before. We'll talk about them later on. And they seem to be void in the roots. So maybe it's that one of the manufacturers combined or used the leaves and the stems as opposed to the roots. And there was problems with that. So I don't think there is a definitive answer for this. Those are three, at least, the possibilities theoretically that could be the issue. And there was the World Health Organization did a big study on reviewing the safety of kava prepared in the traditional way. And basically, it sounds like there's limited evidence of it causing any serious harm except for the skin rashes I mentioned earlier. So that ban was lifted in 2014 in Canada. Herbal, which is published by the American Botanical Council. I like this organization. I'm a member of it, been for years. All that means is I give them money and they send me a few magazines a year, but I think they do good work. And one of the things that they've been doing is they've been publishing a series on adulteration of herbal products, and there's a whole bunch of articles on this. And I grabbed a couple I'm just summarizing a few of the articles from this. One of them is grapefruit seed extract. Okay, not grape seed extract, but grapefruit seed extract. So the citrus plant. I'm sure some of you may have used or heard about grapefruit seed extract being used as an antimicrobial. And the interesting thing about grapefruit seed is that it's never been used historically, as best I know, as a herbal extract. I have a friend who's a herbalist who some of his colleagues were trying to make their own natural grapefruit seed extract as an antimicrobial, and they found that it wasn't working at all. And it turns out that research shows that it's really not an effective antimicrobial, yet these commercially available grapefruit seed extracts on the market, they seem to work really well if you have some kind of infection or to disinfect water and a few other things. And they do work. But it turns out when they did this little investigation, these herbal products, the active ingredients isn't the actual grapefruit seed, but rather it's the synthetic industrial disinfectants that have been added to it. I don't know if it's been added as a preservative or if it was intentionally or non-intentionally. I'm not sure why you need to add a preservative to something that's supposed to be a good disinfectant itself. But anyways, the triclosan, benzyl alkonium chloride, and this other compound there are in there. And those compounds don't look very safe or natural to me. And so here's an example where the herbal product historically wasn't effective for a particular treatment. And the added, again, it wasn't a drug, but it was kind of like a drug, a disinfectant. And that's what was making it so effective as an antimicrobial. So this is kind of controversial. This is still on the market. You can go and read more on the Wikipedia page on this as well. There's some good links and articles on it. So, and I know a lot of naturopaths who historically used it. And I'm sure there's some that still use it and aren't even aware of this. So, and there's a few more articles here. So here's three other ones. They've published some more since then. Another example of adulteration, where here's an example in the U.S. where we know that skullcap is used in Western herbalism, And there's Chinese skullcap, which is used in traditional Chinese medicine and also in Kempo. The genus is the same, Scutellaria. In North America or in Europe, they use Lateriflora, and the one in Chinese is Scutellaria bacalensis. And although there are some similar phytochemicals in the two of them, their indications in Western herbalism is a little bit different than the Chinese skullcap. Chinese skullcap is used to clear heat from the body. It's often combined with other herbs in antimicrobial formulas, while skullcap, used in Western herbalism, the Lateriflora, is typically only used as a sedative to help with sleep, anxiety, maybe some menstrual cramps, but it's not really indicated for infections, at least as far as I know. Now, with the study that the American Botanical Council did, is they took 13 supplement products labeled skullcap, and I guess they did some little investigation with mass spec or whatever it is. And what they found of the 13, 5 of them contain the desired material, these Scutellaria lateriflora, the Western skullcap. A number of them, or one of them, contain Chinese skullcap. So some manufacturer mislabeled or mispurchased their skullcap. I would imagine Chinese skullcap's probably a lot cheaper than the Western European or North American skullcap. And then 4 of the products actually contained American germander. Now, this herb looks a little bit like skullcap, but the problem is that we know that American germander is actually hepatotoxic, and there have been case reports of people taking skullcap and getting liver problems. And I suspect it wasn't from the skullcap; it was actually from some herbal product contaminated with American germander. So on the left-hand side, that's actually a picture of North American skullcap. There's the Chinese skullcap there. They look almost identical, except for the flowers are about 4 times the size in the Chinese skullcap, and the leaf and everything's a little bit. It's like the Chinese skullcap is bigger, and the Scutellaria lateriflora is a little bit more delicate looking. Another example of adulteration is bilberries. Bilberries is basically the blueberry that grows in Northern Europe and England and Scandinavia, and I'm sure in Ireland and Scotland. I suspect it probably grows at a higher in North America to some degree. I think it might, but I don't think that's the main one that we buy here when we're eating blueberries. Bilberries, more stringent than the blueberries that we usually consume. And there's a few different species. So Vaccinium myrtillus is the bilberry, and there's a number of other species that we have in North America as well. Now, bilberry, because it's more astringent than our usual blueberry, it's often used for a number of things, including infectious diarrhea in children. That's one of the herbal indications for it. It's used for eye health. It's used for just the same way that blueberries are. All those antioxidants, those anthocyanins are good for you. I would imagine that in North America, it's probably easier to find blueberry extracts than bilberry. And one of the things that they found when they did a little investigation of the bilberry products on the market is that some of them contain dyes, even charcoal and other plant material. And some of those may be berries from other plants like elderberries or blueberries, but they didn't all contain the bilberries. So that's a little bit frustrating that some of these manufacturers or people selling these herbal products aren't always being honest about it. And then one last little example is black cohosh. Now, black cohosh is used. It's a North American herb, first used by the First Nations people in Canada and U.S. I guess it was just America, or I don't know what they called it at the time. And what's interesting about black cohosh is that there are basically two Latin binomials for it that are sort of acceptable. I don't know why botanists change these over time, but for some reason it's been changed. So there's more recently, in the last maybe decade or two, probably 2 decades now, Actia racemosa is the more recent name for it. And a lot of the herbal textbooks still use the older one, Centesifuga racemosa. So if you look, both of these Latin binomials have the same species, but their genuses are different. But they're both acceptable to use that. Okay. Now, what's interesting is there was a study that looked at adulteration of black cohosh products, and there are 4 different types of, I guess, black cohosh types of species out there. Actia semicifuga, which is particularly confusing because it uses the genus from the 2 acceptable genus and species from black cohosh that grows in North America. So Actia semicifuga has nothing to do with the North American black cohosh. That's often referred to as Chinese black cohosh. And it would be very easy for someone who remembers that Actia racemosa and Semicifuga racemosa are some of the names for it. So it wouldn't be too hard for me to accidentally, even knowing what I know about herbal medicine, to accidentally think that Actia semicifuga was the herb I wanted. But it actually is a Chinese cohosh that has different properties and different phytochemicals. So if you got that, that wouldn't be a good thing. And there's a few other species there as well. You can see that the black cohosh was adulterated with. And so we know that one of the other damaging things that can happen is there are several studies that show black cohosh is ineffective for, I think it was for night flashes, hot flashes, and there are studies that show that it does have benefit. And the question is, the people who did the study, did they use Actia racemosa, or did they use Actia semicifuga, or did they use one of these other varieties? And so maybe the reason why the research shows it wasn't effective is because they weren't using the right plant. There's also been case reports associated with black cohosh. And so the question is it black cohosh that the traditional herbalists, Western herbalists would use, or is it the Chinese, one of these Chinese species that was responsible for the hepatotoxicity? So anyways, a lot of interesting things to be aware of, a little bit frustrating, and I don't really know what to do about all this, but this is one of the arguments for why it's useful to use standardized extracts. And we'll talk about that again some other time. And there was a study that basically went on to say that the suspected black cohosh hepatotoxicity doesn't appear to be associated with the correct black cohosh on the market. So it may be that some of these case reports are unrelated, or maybe they're coming from adulterated products. Okay. So do you guys have any questions? Let me just see how far along I am. 20. Okay. So it took me a while to get through 20 slides. Drug metabolism. It'll go a little quicker now. So some example, we'll talk about drug metabolism quickly, and then we'll just explain how this is connected to herbal safety. So first of all, you take a drug, goes into your mouth. You could absorb some in the mouth, in the stomach, through the intestines, large intestines, small intestines. When herbs get absorbed, they go into your bloodstream, or they may go directly to the liver. The liver metabolizes them and converts them. Some of these drugs will be excreted will go back into the blood and be excreted in the feces or in the urine. Some of them get transformed and get excreted through the bile, and then they'll end up in the feces. So that's more or less what can happen. And then at some point, some of these drugs can be reabsorbed. So generally speaking, when you consume something orally, and it's different if you do an injection, but orally, over time, the levels in your drug will slowly go up. It'll hit a certain amount, and then it comes down. Okay, and this goes pretty much for every drug will follow more or less this sort of path. How quickly it's absorbed and how quickly it's excreted is going to depend on the half-life of the drug. So some drugs may remain in your body for seconds, or they may remain in your body for months. So when it comes to the absorption of drugs, as I mentioned, all different places, mouth, stomachs, intestines, also your skin and lungs, obviously you can absorb some drugs. And when it comes to oral absorption, one of the ways that you can affect the absorption of drugs is by consuming those drugs with herbs that are rich in fiber, soluble fiber, i.e. mucilage, gums, gels, things like that. And so one of the things that these things do is when you take, let's say, a herb like slippery elm, or a herb like aloe vera gel, or psyllium husk, which are rich in mucilage, when added to water, they'll gel up. And when they gel up, they're going to turn into a solid, almost like a jello-like consistency. And now you have the drugs trying to swim through jello rather than through water. So that's going to slow down the movement of those drugs through the intestines, and also potentially slow down the absorption and maybe decrease the absorption to some degree. So it's possible that if you took your drug dose, that it could decrease the amount that gets absorbed and maybe delay the absorption and sort of those peaks that you'd have. So if I took, let's say, here's some Metamucil. I'm not getting any money from Metamucil. That's basically psyllium husk, okay? So if you take psyllium husk, a whole bunch of it, and you add it to water and you drink that, and then you pop some pills with it, those pills are going to be basically stuck in a big ball of jello. And so it's going to delay the absorption and probably decrease the drug levels. And so maybe some of those drugs would never actually make it into circulation. So often it's recommended to avoid combining mucilaginous herbs, or at least high amounts of them, with drugs. So that's one mechanism. Another mechanism is tannins. And we kind of discussed some of this stuff already, but I think it's good to sort of reframe it for you and present it in a different order. So tannins and a lot of phenolic compounds have the potential to bind to certain types of substances. We know that iron and some minerals will form a complex with tannins, and that can reduce the absorption of them. Also, for example, alkaloids, which tend to be nitrogen-based drugs, are more likely to bind to tannins because tannins tend to precipitate proteins, and proteins consist of nitrogens, and alkaloids also have nitrogen. So I think if you were to take some kind of alkaloid-like drug, maybe an opioid, or that's just one that pops into mind, along with a lot of tannins, you could potentially have an effect and reduce the effect. So we know there are a number of foods that can decrease the absorption of iron. So if someone wants to take an iron supplement, you kind of want them to avoid taking it along with herbal teas and herbal products. So we know, I think everyone knows black tea does, but peppermint and chamomile tea, which are commonly consumed herbal teas, and I would say a lot of vegetarians and vegans that are low in iron are going to be consuming lots of plant material rich in polyphenols, and probably drinking peppermint teas and chamomile teas. All those things you'd want to take away from your iron supplement and some of your other minerals. Black tea, green tea also does that, and chocolate. And one of the reasons why a lot of people will add milk to black tea is the proteins in the milk will bind to the tannins in the tea, and form a complex, and it reduces the astringency. So drinking black tea would affect your iron absorption. Drinking black tea with a little bit of, with a little bit of milk wouldn't have that same effect. So if these 5 plants or herbs up there can decrease iron absorption, I would say most herbs that are rich in polyphenols probably are going to have some impact on minerals and might have some impact on some other prescription drugs. So it might just be wise to separate them if you can. So what ends up happening if you have a cup of tea with your iron or certain drugs, it's not going to be all drugs, just certain drugs, it'll decrease the amount that gets into your system. It probably won't delay it. It's probably just going to decrease it. That's kind of what I'm thinking anyways. Now, realistically, if you take an iron supplement, you're never going to absorb 100% of it. And sometimes I just tell patients, just take it whenever you can, because I'd rather have them take it than not take it. And if they get too hung up on whether they can have it with their breakfast or not, they may forget to take it away from meals. So appreciate that. It's not that the black tea is going to bind up all the iron, it's just going to reduce the levels. So you're still going to get some in, but instead of getting 80% absorption, maybe you're only going to get 65 or 70% absorption, okay? Orange juice, which has phenol, so you think that it would potentially decrease iron absorption. It does enhance iron absorption of some types of iron anyways, and that's because probably the vitamin C is involved with ionizing the iron to make it easier to absorb. But maybe there's something else there, because apple juice, which I'm pretty sure has vitamin C in it, it doesn't enhance the absorption of iron. So, here's 2 fruits. One of them helps with iron absorption, the other one doesn't. So I don't really know why you get a 2-fold increase with orange juice, but not with apple juice, which is interesting. So maybe there's different phenolic compounds that bind up the apple juice, or maybe it's something else in the orange juice that's beneficial. And Matthew Richards says, I heard it's the citric acid. And that could be it. And Danielle says, don't apples have more ellagic acid? They have, I don't think the ellagic acid's in the juice, though. I don't know. I'm not going to comment because I don't know. So, when it comes to drug metabolism, this is basically a quick little intro to what happens when things go through your liver. So if you have a drug and it goes into your liver, it undergoes something called phase 1 detoxification. So phase 1, what it does is there are a number of enzymes that are called P450 enzymes, and there are different CYPs. CYPs are basically little versions of these. So there's like a CYP3A4 and a CYP1D7 or whatever. I don't remember all the names for them. And they have different substrates that they target. So what happens is if you take a particular drug, it'll bind to a specific group of P450 enzymes, and typically it oxidizes. It could reduce as well. And when you oxidize or reduce a compound, it's going to change its reactivity, and it's also going to change how water soluble it is, okay? So generally speaking, when something undergoes phase 1 detoxification, it's making it more active, or it's making it more reactive, or it's making it more oxidized and more water soluble. And both those are going to make it useful to help you get rid of it. Because the whole purpose of your liver is to get rid of stuff. And if it's not a vitamin or a mineral, chances are it's going to be considered non-essential for the body and potentially harmful, so your liver wants to get rid of it. So phase 1, oxidize or reduce, usually oxidize, thing becomes more reactive. So that little star you have in the middle there, looks like a ninja throwing star there, that's a reactive intermediate. Now, with phase 2 conjugation, what happens there is your liver takes some kind of cofactor, and it could be, there's a whole bunch of different types, sugars and amino acids and a few other things, and it'll stick it onto that reactive intermediate. And by doing that, you've created a conjugated drug, which is hopefully going to be easier for your body to excrete. And in some cases, it also neutralizes that reactive intermediate there. So with phase 1 detox, again, there's a whole bunch of different enzymes that are involved with changing the actual drug structure. And the only problem with this is sometimes when you create those reactive intermediates, is sometimes those can be toxic compounds. And so one of the things with those reactive intermediates is, for example, with Tylenol, when you take oral Tylenol, it's totally safe. But when it goes through the liver, it forms a reactive intermediate, which those little throwing stars, let's say that's the Tylenol, those are the things that are now dangerous and start damaging your liver. It starts basically reacting with your liver and can eventually lead to liver failure and cause death. So in this case, Tylenol is safe, but phase 1 makes it dangerous. Also, phase 1 detoxification is responsible for making certain things in like the char on barbecued meat, which tastes so delicious, or the tar in cigarette tobacco. It gets metabolized by the phase 1 detox process by these P450s, and those compounds become reactive intermediates. So it's kind of like some of these things become, cigarette smoke and barbecued meat becomes more dangerous because it's processed by the liver. So with phase 1 detox, there are certain supplements or certain herbs or herbal products that can increase or decrease phase 1 detox, and you have to know this for the exam. So the first thing is grapefruit juice. So grapefruit juice contains those phenylcoumarins that we described in the first half of the course. Bergamot is one of them. And what it does is it inhibits phase 1 detox. And by doing that, you potentially raise the drug levels of those drugs that are processed by those P450 enzymes. So if this is your desired drug level, what ends up happening is when you have grapefruit juice along with certain types of drugs, not all of them, only the ones that are metabolized by those particular enzymes, then you could get your drug levels exceeding the desired levels. Now, in the case of statin drugs for lowering cholesterol, we know that grapefruit juice will elevate those potentially. Now, if you're on a low dose, like a 5 milligram or even a 10 milligram dose, it's unlikely going to cause any harm, and there's going to be some benefits from taking that grapefruit juice potentially. If you're at maximum dose, or if you're really susceptible to the side effects of the statins, then taking grapefruit juice with it could be problematic. So there's basically a kind of a black box warning: don't take grapefruit juice with statin drugs. However, there's certainly looks like there's some emerging data that maybe pharmacists and doctors and researchers are being a little overreactive. There's a few different studies that basically say that although it does raise the drug levels to some degree, it may not be clinically significant. So grapefruit juice should not be contraindicated in people taking statins. And another study was saying that for the majority of patients, complete avoidance of grapefruit juice is unwarranted. And I remember my grandfather-in-law, when he was down in Florida, hanging out with all of his retired people, they're all in their 70s or 80s and 90s. He said, "Oh, everyone down there is on a statin-lowering drug, and they're all drinking grapefruit juice every day, and they don't care, and nobody has any problems." And so, that's anecdotal evidence, which I thought, well, maybe it's not a good idea. But now there is some other evidence emerging that may not be the case. The reason why it's good knowing this is that it's good to keep it in your back of your mind. If someone's on a high dose and they're on these medications of statins, and they're getting some muscle pain, and they're drinking, and they weren't getting it before, but now they're drinking grapefruit juice, maybe there's a connection there. Chloe's asking, and Chloe's asking good question. And this is something that's never been explored, but she's basically saying, could you take grapefruit juice or another phase 1 inhibitor with certain medications to reduce the drugs or to make them more bioavailable? And I don't know if anyone's doing this yet. I think that's a very novel therapy. I've always kind of wondered if there could be a spot for using grapefruit juice along with, let's say, antiretroviral drugs used with HIV patients, for example. So I think in theory there is that potential, but no one's doing that synergy. It's just like using those flavonolignin along with certain antibiotic drugs might increase their efficacy and decrease drug resistance. Because this, in a way, is a type of drug resistance, in a way, or not not drug resistance, but you know what I'm saying. The drugs can be broken down by the liver, so if you stop the liver from doing its job, then you could elevate drugs, and that could be potentially a good thing or a bad thing. So phase 1 inducers. So if you stimulated phase 1 detox, then what's going to end up happening is you're going to potentially increase these reactive intermediates and also decrease potentially the active drug. And so we know that, for example, St. John's wort, it's notorious for having this particular drug interaction. And it appears that with things like the birth control pill, certain antiretroviral drugs used for HIV, or those are the two big ones that are discussed, that if someone's on St. John's wort, it could affect these drug levels. And in the case of a birth control pill, possibly that it could disrupt the hormone levels in the body, and that could lead to maybe ovulation and could cause an unwanted pregnancy, which could be a negative side effect for someone. Or in the case of HIV medication, if you're depressed, you've got HIV, you're taking medications for it, you take some St. John's wort because you think it's a natural antidepressant will help you, that could actually lower the drug levels, and that could be a bad thing because it could cause the virus levels to raise, to not be, the viruses not to be cleared as quickly, and could that could be a bad thing, okay? So in the case of St. John's wort, it's going to basically decrease the drug levels because you're stimulating the liver to break them down quicker. And we know that with St. John's wort, we know that it has the potential to affect the efficacy of a whole bunch of drugs. So benzodiazepines, these are drugs like Valium, levodopa, which is used for Parkinson's, phenobarbital, carbamazepine, phenytoin, those are all anti-epileptic drugs. Statins, I mentioned, antiretrovirals were mentioned, and hormones. So the take home here, you don't have to memorize any of those drugs for the exam. I'm only giving you a list of drugs so you know. But a lot of those don't mean anything to you. But there's just, the take home is St. John's wort interacts with lots of drugs potentially. Some other safety concerns with being on it is it can cause photosensitivity. And with people who are either bipolar or schizophrenic, who are prone to psychotic episodes, it can aggravate those for whatever reason. So St. John's wort, it's a great herb, just so you know. It's like probably the best researched herb showing benefit for mild, moderate, and severe depression. And it has, compared to antidepressant drugs, it has very minimal side effects. But, so I'd say it's a really safe drug as long as you're not taking other drugs with it and you don't have bipolar and schizophrenia. So phase 2 detox, as I mentioned before, this is where you take that reactive intermediate and you stick something onto it to neutralize it and make it easier for the body to excrete or get rid of, okay? So the types of things that you can stick on to that reactive intermediate can be things derived from amino acids. So glutathione is a oligopeptide made with 3 amino acids. Cystine's one of them in there. So you can take glutathione or cysteine alone. Both those are added on to these reactive intermediates. And just as an aside, cysteine is the antidote to Tylenol poisoning. And one of the problems with Tylenol is if you exceed your body's reserves of cysteine and glutathione, that's when it becomes toxic, because it can no longer be neutralized by these two substances. Just as an aside, I had a friend of the family who was a 30-some-year-old vegan woman taking Tylenol for carpal tunnel syndrome because she was a grape pruner. And one day her friends were like, "You're looking jaundiced. You should go to the hospital." And she went to the hospital, and turns out she had liver failure, and she ended up dying. This 32-year-old woman ended up dying from liver failure. And I don't know all the details of it, but what I wonder is, I do know that cysteine and methionine, which are two sulfur-containing amino acids, are generally speaking lower in a vegan-based diet than in a meat-based diet. And high amounts of cysteine is bad for you, just like low amounts of cysteine is bad for you. You know, it's that dose. You need that right dose. So I don't think it's a bad thing that vegans, and we know that a vegetable-based diet is better for you than eating a lot of meat. But unless you're taking a lot of Tylenol, I suspect that because vegetable-based proteins are relatively low in cysteine, it may be that the amount she had in her body wasn't sufficient to handle. Maybe she was in the therapeutic range of Tylenol, I don't know. But in her case, being a vegan may have been working against her, because she wasn't eating cheese and eggs that contain cysteine. And so as a result, perhaps she was more susceptible to it. And maybe the dosage range, like, is pretty broad. And I suspect that vegans and elderly patients may be more susceptible to Tylenol toxicity than a young meat eater, for example. So those are two amino acids. Glycine is another amino acid. Glucuronic acid is a type of sugar. It's often used to conjugate estrogens and other compounds. S-adenosyl methionine is related to B12, folic acid, and it's used in methylation reactions. And then acetyl-CoA, one of the B vitamins that's involved with some acetylation reactions. And if you remember, acetyl is easy to add on to things. So when you have salicylic acid, you can stick an acetyl group onto it and make it acetylsalicylic acid. And it just changes its structure and solubility and inactivates it and some other things. So going back up here, so there's a few different things you can conjugate with them. Just as an aside, I don't think there's a whole lot of harm in upregulating phase 2 detox. I see the potential for harm for upregulating phase 1 detox, but not phase 2 detox in most cases. And there's a number of liver herbs like dandelion and turmeric. Some of these have hepatoprotective effects. We know that there's the glucuronic acid conjugation is under the control of an enzyme called UDP glucuronol transferase. And it looks like both dandelion and turmeric, which are great liver herbs, seem to upregulate that enzyme. We know that certain sulfation reactions, like that involve cysteine and glutathione, these can be upregulated by eating broccoli sprouts and broccoli and cruciferous vegetables, because they contain sulforaphane. Also garlic, which contains sulfur, and turmeric, because again, all these increase the capacity for your body to detoxify using glutathione. So those are just a couple examples, but I can see potential for herbs being useful to help support the liver function. So here we got your phase 1 detox, you got your reactive intermediate, and then in this case, let's say that was toxic Tylenol. If you run out of your cysteine or your glutathione, then what ends up happening is you no longer can conjugate that drug, and now these little dangerous ninja throwing stars will attack your liver and you might die. You can read through some of these if you want. And I think one more slide or two before we take a break. So milk thistle, classic herb used as a hepatoprotective. So it helps protect the liver from toxic injury, and it also supports phase 2 detox, and it does not affect phase 1 detox like it doesn't stimulate it. It may actually slow it down. And so we know that it protects the liver, it stimulates regeneration of the liver. So they've done studies where they'll take a part of the liver out and then it'll help it come back quicker. The liver is one of the few organs that can regenerate. It's got some antioxidants, as we described already, from these flavonolignin. It's been known to stimulate glutathione production. It acts as a little shield to prevent toxins from binding to the liver. It also inhibits an enzyme called beta-glucuronidase. Now, that enzyme is found in some of the bacteria in your gut, and it's responsible. So normally when you take glucuronic acid and you add it to, let's say, estrogen, it gets excreted in the urine or in the feces. If it's remaining in the bowels for too long, what can end up happening, or even regardless of how long it's in there, certain bacteria will look at the glucuronic acid, because this is a nice glycoside. They'll chew that sugar off of it as a fuel source. And then what happens is, once you remove the sugar from the estrogen, it no longer is water soluble, and it can now be easily can pass through the cell membranes in the intestinal wall and be reabsorbed and cause elevated estrogen levels potentially. And so that enzyme used to cleave the sugar, the glucuronic acid, from the estrogen is the enzyme called beta-glucuronidase. And so what's kind of neat is milk thistle works not just in the liver, but outside the liver to help prevent that deconjugation that some of these gut bacteria will do. And then finally, when it comes to the phase 1, phase 2 detox, it appears that it may slow down phase 1 and then also help to regulate, modulate, and increase phase 2 through these various mechanisms. So pretty safe. Herb doesn't seem to have a lot of negative, like it doesn't get the same negative press for messing up drugs as you get from the grapefruit juice and the St. John's wort. It seems to be a lot safer. They've done studies with milk thistle and HIV drugs, and most of them don't show it decreases drug levels. Okay, so let's take a little break there, and we'll come back in 5 minutes. And yeah, we'll take 11:05. We'll continue. Okay. Okay, what I'm going to do is I might just keep talking and recording. If I go over our usual time, then you can just, it won't be over much, but then you can just watch the remainder when I post it afterwards. I shouldn't be that much late. I might be around time. So, okay. So when it comes to safety studies, so how do we evaluate safety? Some of the stuff we know just from history. When it's amazing when you look at some of the Chinese textbooks, they'll have warnings and contraindications for herbs. We also have it in Western herbalism. I think just historically we figured some of this stuff out. But there's some scientific ways to do it as well. Now, when it comes to drugs, one of the first things you do is you do studies involving the drug in, let's say, cell cultures or animal studies to establish whether these drugs are safe or not. So they'll literally take a bunch of rats or mice or animals and give them high amounts of the drugs and see what happens. And so if it kills the animals easily, then you know that could be a concern with it. So the advantage of doing in vitro and in vivo studies is that there's no harm to humans, which is good. However, appreciate that a test tube has a very different metabolism, or has a different, test tubes in animals are different than humans. And so rats have different livers and different kidneys. I mean, we're going to metabolize drugs differently. We're going to react differently to it, which is a disadvantage. But the one advantage is it causes no harm to humans. The second advantage of these in vivo and in vitro studies is that you can really kind of focus in on a particular side effect. So you might look at hepatocytes in a test tube and see what happens if you add a whole bunch of drugs in there. So you can maybe specifically tease out some of the subtleties of how these drugs might work that you wouldn't be able to do in human studies. Now, as I mentioned, humans are different than test tubes and rats, so that's not that's one disadvantage. We also don't really understand in a test tube if you're taking a particular drug, what's happening when it's metabolized by the liver. So, in the case of Tylenol might be safe to one type of cell in the body, but it's not made toxic until it's metabolized by the liver. So that's the pharmacokinetics. And more importantly, sometimes these studies will take, let's say, we know that there are certain compounds in plants that could be toxic to the liver. And so if you did a study where you took a high dose of these compounds and you gave it to a rat or to cells in a test tube, and it caused problems, it may not be reflective of the levels that you would taking the recommended dose. So in the case of alcohol or Tylenol, one glass of wine or 500 milligrams of Tylenol may be safe. But if you're taking 20 grams of Tylenol or you're taking a 40 ounce of whiskey, that would be toxic. That doesn't mean that alcohol itself is always going to be toxic. So sometimes people can jump to conclusions that aren't necessarily fair. Case reports. So what happens is someone will basically go into the doctor having a problem, and the doctor suspects that there may be a connection to it, the drugs they're on or to a herb they're taking, and they may publish this. And so the one benefit is by publishing this, it can sometimes, especially online, it can give quick communication between the clinicians. If all of a sudden there's a number of these case reports coming out, then people start going, ooh, it looks like we have an issue here. We've seen 3 case reports associated with this herbal product or this drug. We should pull it from the market, or whatever the correct response might be. The disadvantage is it's only one person's opinion, and it's only one case, and so you can sometimes get a publication bias. I'll show you an example of that later on. Certainly you get these publication biases occurring when it comes to natural products. There's a natural distrust of natural products by, I would say, conventional doctors and researchers. And so sometimes they're treated differently than, there's a little bit of discrimination. They're treated differently than you would a drug. And then finally, clinical trials. So clinical trials usually involve large groups of people, and they have a control group. It's much easier to remove confounding variables when you have both people taking the drugs and then a placebo group. A lot more people than you'll get from a single case report. But the main disadvantage is cost a lot of money, takes time, it's hard to recruit people, which is challenging. I've been involved with someone, and it just took us years to get enough people. We only needed like 50 people or 100 people. We couldn't even get that from volunteers. And then I guess the other problem is that if you're trying to evaluate if a herb is or a drug is unsafe, you couldn't do a clinical trial to find out how many people in the group will get sick from taking a particular herb. I mean, that just isn't ethical. But if you accidentally discovered something, then that would be a good thing to publish. So publication bias. Oops. This is an interesting little publication. Canadian family physician. I remember reading this. I just stumbled across it when I was working at Parkdale. I was reading through their little magazines. And the author basically said one of his patients came in who had hemochromatosis, and the patient was also taking a milk thistle product, and he started getting some liver issues. And he blamed the milk thistle product, and saying that people should be aware that this could increase, complications associated with hemochromatosis. But what's interesting is, if you look at some of the research on this, there's another study published a couple years later where they basically found that, and what hemochromatosis is, to give you a quick little background, is it's an iron overload disorder. And so if you have too much iron in the body, it starts damaging the liver, the arteries, and increasing oxidative stress and being bad. Now, in this other publication, what they found was that not only is it unlikely that milk thistle is going to cause these problems seen in this other patient, but it appears that it actually chelates iron, and that would decrease the absorption of iron. So in this case, according to this study, it appears that milk thistle might actually be beneficial for reducing iron levels, and it might actually have a positive effect on hemochromatosis. And so I can't say for certain it would or it wouldn't, but there is a number of other studies that show benefit of milk thistle for hemochromatosis. So when you look at the original study, it was published by a medical doctor. When you read the details, the person was also taking certain medications, drinking. He was also pre-diabetic, drinking a lot of soft drinks. All those other things can elevate liver enzymes. And so it's funny that he failed to mention any of those other things in the abstract and only focused on the milk thistle, when it may be that maybe the milk thistle was helping to reduce his liver enzymes, and that he had fatty liver disease because he had diabetes and he had all these other problems going on, and he was taking some medications as well. So anyways, it just sort of irritates me when I have to defend herbs. So we'll talk about some adverse reactions and something called the therapeutic index. So as you guys might remember, everything is poison. It just depends on the dose, okay? Just like Paracelsus said. So what we always want to do in our minds when we're looking at treating a patient is you do your risk-benefit analysis, risk-benefit, and also cost analysis. That's another thing I always do, because people get upset if you send them home with $500 worth of supplements when they came in with a urinary tract infection. They're probably going to be annoyed, just because it's a lot of money to spend on something that's not really that serious. So you always got to consider the cost as well. But most important is looking at risk benefit. How likely is it going to work, and what are the risks and side effects? Now, there's something called the therapeutic index used by pharmacologists. And what this is this is a number they basically calculate based on what the effective dose is to get the desired results versus what the lethal dose is. So they'll actually take, let's say, one of the studies they do, which is a little gruesome, is they'll take a bunch of rats, let's say, and just start poking in a drug into them until they kill off 50% of the rats that they have. And that's what the LD50 is, like how many grams of the drug is required to kill 50% of your rat population. Now, this has never been done with humans because of the obvious ethical concerns, but you can appreciate it's a nice number to know, but it's just a little bit awful how they get it. So this therapeutic ratio refers to the LD50, so how much of the drug is required to kill half the population, and the ED50, which is the effective dose. So the therapeutic ratio is a toxic dose is the TD50 as opposed to the lethal dose. So either way, you're basically looking at how much will hurt you versus how much is good for you. Okay. Now, generally speaking, as you increase the amount of a drug you give, the risk of having a side effect also goes up. And so the more of a drug increases, potentially more benefit to a certain degree, but also more side effects. So going back, when you have something called a broad therapeutic index is kind of a ratio between the amount that's good and the amount that's bad, okay? And so this is kind of going back up to your therapeutic index. It's the same idea. So if the drug is relatively harmless and you can take a large amount for it to be effective, then you're not going to get into trouble. So if you look at this one here, a broad therapeutic index would apply to a herb like chamomile. So the take home is, if it has a broad therapeutic index, it's safe. So whether I have 10 milligrams of vitamin C or 5,000 milligrams of vitamin C, it's very safe. And there's a little bit of a side effect starting to appear at the bottom here, and that might just be some loose stools or digestive complaints. Nothing serious with vitamin C. Appreciate those that in this case, in some cases, 300 milligrams or 1,000 milligrams of the active drug or nutrient or whatever it is that you're giving is almost as effective as giving 50 times as much. But when you give 50 times as much, you get a little bit more health benefits from it, but just not that much. But what you might be getting is increasing your side effects. Regardless, this is still considered to be a safe plant. So if it's chamomile tea, maybe whether you drink 10 cups of chamomile tea or 1 cup of chamomile tea, you're going to still feel relaxed with both, but you're not going to feel 10 times more relaxed with 10 times cups. You might feel twice as relaxed, but not 10 times as relaxed. So it's not linear, okay? It does plateau. So broad means safe. Here's an example of someone who's taking maybe what would happen if you took a drug that had or a herb that had a narrow therapeutic index. So even at low dose, there are side effects associated with it. And as you increase, it may be that the benefits don't get any bigger. Maybe they even get smaller over time, and the toxic amount increases. And there are certain drugs and herbs that have a narrow therapeutic index. So ones might be like, for example, digitalis, where the crazy thing with a drug like digitalis is that as you take it over time, you might actually have to lower the dose because it starts to accumulate in the system and could cause, side effects. So narrow means danger. Okay, aconite, belladonna, datura, things like that are ones that you have to be careful of. So I'll give you a couple examples of herbs that have a narrow therapeutic index. Monk's hood or wolfbane. I've never used this in herbal medicine. It's used in Ayurvedic medicine and Chinese medicine. I'm pretty sure in Ayurvedic medicine. It's used in Western herbalism. It acts as a nerve blocking agent, and it does. It's pretty serious. A few flowers, if you were to ingest them, would cause death. This grows in. I've seen it walking around Guelph, growing in people's gardens. It's a very pretty plant. It is possible to absorb some of the toxins right through your skin. So just if you had this rubbed against your skin, or if a child was for some reason decided to eat some of these flowers, or was maybe playing in the flowers a lot, they could absorb a little bit of the toxic compound, and that would be bad. So basically what it does is it blocks voltage dependent sodium channels, which are used for nerve conduction. And so it results in basically paralysis if you consume this. Herbally, in Chinese medicine, they'll cure it and process it so it's less toxic, but it still is an issue. Okay, so an overdose will cause basically your nervous system gets depressed. Initially, it will cause nausea, vomiting, diarrhea, and then it kind of has a suppressive effect, and then will cause increased heart rate, palpitation, and then you basically die from respiratory collapse. Okay, so even though this is used historically in herbal medicine, in both Western and Eastern, I wouldn't mess around with it. If you want to experiment, rub the flower against your lips will start to go numb and tingly after a few seconds. So you can appreciate the power of it. I mean, don't experiment too much with it. I don't want you to die and blame me, but yeah, it's pretty serious stuff. So here's a case where there are 7 cases of fatal aconite poisoning over a period of time. What was it? A 10-year period in China. So it's not tons of cases, and they got about 1 billion people over there. But appreciate there are still people dying from it. So from accidental poisoning of it. There is also, I don't know if you remember hearing this back in 2010, there was a woman in, I think she was in London, England, who I guess she was upset with her husband, and she murdered him using aconite, just slipped it into his curry and killed him. So not a very nice thing to do, but I wonder what her husband was up to. Not to justify what she did, but just kind of wondering. Another group of herbs that have a narrow therapeutic index are ones that contain those tropane alkaloids that we discussed before. And so tropane alkaloids have an anticholinergic effect. And as we mentioned before, this suppresses the parasympathetic nervous system. The good thing is they're used as antidotes for nerve gas poisoning. They can be used as drugs to suppress peristalsis and cramping of smooth muscles. They can be inhaled for asthma. So there's some good stuff associated with them for sure. So deadly nightshade and Jimson weed are the 2 main herbs that have been used in Western herbalism, and also actually Jimson weed's used in Central and South America, and they use it in India as well. So I'm sure TCM, I'm sure it must be. So it basically blocks these muscarinic receptors. I would say that when you look at deadly nightshade, a few berries might be enough to make a small child sick and result in death. 10 berries is usually kind of what I've read might be like a lethal dose in adults. I already gave you guys this before. We know that, for example, datura, which is both deadly nightshade and Jimson weed, are in the Solanaceae family. The same family as tobacco, tomatoes, potatoes. So historically, shamans in South America use this as an hallucinogen. It works differently than the ayahuasca and the magic mushrooms and these other ones that generally stimulate serotonin receptors. even shamans in the Amazon, South America, or in the Amazon and Central America are very wary of this plant because it's kind of dangerous. They recognize it. So although ayahuasca, magic mushrooms, it's very safe way to hallucinate if that's what someone was trying to do. Jimson weed wouldn't be something you want to mess around with. Even with shamans, they have a lot of respect for it and don't use it very often. And so occasionally you'll hear reports of someone getting an accidental poisoning from taking Jimson weed. So there's a few boys that have read on, I guess, on the internet that you could get high smoking Jimson weed or ingesting it, and that's what they did. But what ended up happening is they ingested the seeds, and two of the boys remained in critical condition. I don't know what happened to the third one. I can't remember. Anyways, so here's a bunch of kids that basically had a bad thing happen because they took too much and they didn't know what they're doing, and they suffered from an accidental poisoning. I guess one of them, I don't think any of them died. So that's in Canada here. Now, this is, the report of this is actually pretty funny if you read about it. There was back in 2010, they weren't deliberately trying to ingest the Jimson weed to get high. Someone made like a chili and they threw in some Jimson weed seeds into it, or the leaves in for a spice or flavoring. And there was a family ranging from about 38 to 80 years old, and they ate this meal at 9 o'clock, and one of the family members was late coming for dinner, so he didn't actually show up until an hour later. And when he arrived, all six of these family members were kind of laughing, and they're confused, and they're hallucinating, and dizzy, and thirst. Luckily, he came when they did. They called the paramedics and rushed them off to the hospital. They figured out what the problem was. The antidotes for these are pretty easy to treat. To give some kind of I'm assuming it would be a cholinesterase inhibitor or something like that. But anyways, everybody survived and it was fine, but it could have been a bad thing. So there are people who have these issues, okay? And again, if you read about the side effects, it's basically hot as a hair, blind as a bat, dry as a bone, red as a beet, mad as a wet hen. So hallucinating, crazy, dry mouth, dilated pupils, increased heart rate you typically see with it. And rapid pulse would be it. Okay. Got a question. Sorry, Chloe, I'm a little late. Somebody asked me, what do you use monk's hood therapeutically? Therapeutically is used for neurological conditions as a nerve block. In homeopathy, they use it for extreme anxiety like stage fright. I think it may have probably some sedative properties that maybe they use it for sleep aid. In Chinese medicine, I remember reading it has some antimicrobial effects as well. But I can't really remember what I'll use it for. Yeah. So essential oils, you guys, we've already discussed essential oils before. So, oh no, we haven't. We will. Sorry, I've already talked about it because I recorded this. So essential oils in general, we're going to talk about the safety concerns. So basically what they are is you take some kind of plant that's rich in essential oils and volatile oils. You pass steam through it. You collect the steam and the water vapor along with the small molecules of evaporated off these hydrocarbons. You just basically separate them and you get your essential oils. So these are non-polar, so fat-soluble compounds, usually about 10 to 15 carbons in length. I think you can get some 20 carbon ones, and there's probably some 5 carbon ones, but the majority are going to be about 10 to 15 carbons. Now, once you have the essential oil obtained, you can use it topically, orally, you can inhale, lots of different things you can do. Some of them are very safe, like peppermint oils is I would say, a really safe thing. While some of them, like let's say wormwood oil or wintergreen oil, um, you could die from an overdose fairly easily. So in general, I think it's safe to say that a lot of essential oils, like even if you're cooking with essential oils, like you make a spicy curry that's got rich in these aromatic compounds, one of the most common side effects is that it tends to relax smooth muscles and relax sphincters. So a lot of people who eat spicy food, chili or curry or whatever it may be, will get a little bit of reflux, causing a heartburn. Okay, that would be one thing. Also, essential oils are basically turpentine, right? It's like paint thinner. So your body doesn't really want to come in contact with too much of this or a concentrated form. So if you stick it in someone's eye accidentally, or if you deliberately put some, let's say, tea tree in someone's ear, but it's the ear is a little bit irritated and the tissues are going to be inflamed, it could, pure essential oils could really cause it to burn. It could be irritating to it. Also, orally or on your your mucous membranes in general, whatever part of the body, you wouldn't want to apply a lot of these essential oils in concentrated forms and pure. Now, orally taking a little bit, like if you're taking like 5 drops of oregano oil, it's going to be safe, other than possibly a little bit of heartburn in some people, but for the most part, it's going to be safe. Appreciate also those that oregano oil you can buy. Usually, when you buy it, it's been diluted with olive oil, so it could be a 1 in 5 dilution or a 1 in 2 or a 1 in 10 dilution. Depends on who the manufacturer is. So I'm not really too concerned a little bit of oregano oil, but there's a big difference between taking a teaspoon of, let's say, peppermint oil or oregano oil compared to a teaspoon of a tea made from peppermint or from oregano, or a tincture of oregano oil. Like, it's way more concentrated. So the dose is going to be totally different. So high amounts, let's say if you were to take 5 or 10 mils of an essential oil, it's going to start damaging your liver and your kidneys potentially. And some of them have neurological effects and could cause seizures and other problems. So 5 to 10 drops here and there, depending on the essential oils, unlikely to cause any harm. Now, I'm going to give you a few examples of specific safety concerns that might exist that we're aware of, okay? Lavender oil. I love lavender. I think it's a great herb. Lots of research showing that the smell, like the essential oil, just smelling it or taking it orally, can help with relaxation, anxiety, certain sleep conditions. It has a pleasant smell to it. It's often included in creams and shampoos. I think it's relatively safe. Now, not to sound sexist by any means, but I think that a lot of men, I think women appreciate the smell of lavender more than men do. For some reason, a lot of men have a natural aversion to putting a lot of lavender on their bodies, and maybe there's a good reason for this. And it appears that lavender essential oil does have some estrogenic effects, and that there are several case reports that have emerged showing that young prepubescent boys that were being exposed to lavender, usually in the form of a shampoo or some kind of topical cream, started developing what's called gynecomastia. So they started, that essential oil in the lavender appears that it may have gotten stimulated the breast tissue in these young boys to be stimulated, and started developing like little breast buds, which luckily is benign and it goes away. It's reversible if you discontinue the lavender, but certainly a little disconcerting for the parents. And long term, I don't know what this would have, what kind of effects this would have on men in other ways, okay, or boys in other ways. So I've always kind of found that although I like the smell of lavender, I've always never really wanted it on my skin. I like smelling it, I don't want it on my skin. And maybe I was right. It's more of a feminine herb and smell that shouldn't be on men. That being said, spraying it in a room, we often will spray it in the room where the kids are, just to kind of create an environment and makes it easy for them to sleep. I'm not worried about it in that situation. Now, in this case reports, they weren't sure whether it was the products that contain the lavender or tea tree. I'm not convinced tea tree is an issue. I think it's more likely to be the lavender, but I guess there's still some concern over tea tree having that effect. I'm just not convinced about that. So not too serious a side effect from the essential oil. This one's a lot more serious. Thuone. So thuone. Oh, I hate when my slides do that. Oh, so irritating. Let me go back up there. So thuone, which is you can find it in a number of species of cedar. So white cedar, yellow cedar. The Latin binomial for them is Thuia. So it's species I've written down there, but it could be a few different types of species that have thuone in it. And presumably they gave it the name thuone because it was found in a number of species of cedar. Thuone is also found in sage and in the infamous drink or liqueur absinthe, which is made from wormwood. So Artemisia absinthium contains thuone, and thuone is one of the volatile oils. So wormwood as a tincture or as a tea will have small amounts of thuone in it. It's not that much. Probably more if you have it in a tincture, just because it's going to be extracted a little bit better with the alcohol. And small amounts I'm not really overly concerned with, but if you had the pure essential oil, you ordered some, let's say, wormwood essential oil online, and you drank 5 mils of it, that could be enough to have some really serious side effects. Thuone is a neurotoxin, and so remember when we're talking earlier about GABA. So GABA system has a calming effect on the body. So things like kava stimulates the GABA system and has a calming effect. Pardon me. Thuone does the opposite. It blocks the GABA system, and in particular the GABA receptors, and as a result, it stimulates the nervous system. And why that's bad is it gets the nerves to fire more easily. And so that early symptoms, if you had like a little bit of a thuone overdose, might be like a mild headache, and then you could start getting your muscles start cramping up and spasming. And then if you get a high enough dose, you'll get involuntary movement of the muscles and convulsions, and it could lead to death. And so it's pretty serious. So one thing you might want to be careful about is giving herbs like wormwood or cedar and even sage. Maybe, I don't know, maybe too much sage ravioli, giving it to an epileptic patient might not be a good idea, but just a thought. So watch out for thuone. Now, when you look at, let's go back to this. So if you remember the early Impressionist artists, I don't know why am I fading in and out? It's not working. Let me go back up there. So the early Impressionists, here's some various paintings. These have illustrations of absinthe in it. And absinthe is something that, for example, Van Gogh and a number of these other artists used to consume a lot of. Now, if you look at them, they're all seem kind of depressed. It's not really a good thing to do a lot of, but I guess it gives a pleasant sensation where the alcohol acts as a depressant, but the thuone content acts as a stimulant. So it's kind of like you're both drunk and kind of impaired and sluggish while being stimulated at the same time. Probably like having like Red Bull and Jägermeister or something like that. I don't know. I'm just speculating. In this case, with having a little bit, it's not going to have an issue. But if you're an artist and you're prone to drinking a lot, what can end up happening is people can start suffering from absinthianism. And that basically what it is from chronic exposure to drinking absinthe, which is a liqueur made from wormwood. It can result in depression, mood disorders, sleeplessness, tremors, and also psychosis. And if you look at Van Gogh, everyone knows that Van Gogh, I think most people know that Van Gogh suffered from some serious mental health issues. He did some kind of crazy things in his life. he once thought it would be romantic to cut his ear off and send it to his girlfriend. I don't know how well she received that, but I would imagine that the wormwood that he was drinking, the absinthe that he was drinking regularly, may have influenced his decision in that. I mean, I can't say for certain, but also, just as an aside, wormwood contains other compounds that when you consume a lot of wormwood, it does create like a yellowy green change to your vision. That wouldn't be due to the thuone, I don't think. It's another compound in there. But maybe that's what inspired some of the colors that you'd see in the early works of the Impressionists. So if you look at here, glass of absinthe, here's a green fairy. The green fairy is sort of one of the names for absinthe that people refer to it. Here you see a bottle of absinthe on the ground there. These guys are drinking absinthe. You know, no one looks very happy, so you don't want to drink too much absinthe. You can buy it. It's banned to buy real absinthe in Canada and a number of other countries. You can buy absinthe, but the thuone's been reduced or removed from it. And but you can buy real absinthe in Eastern Europe because they don't care about that kind of stuff there. Another particularly dangerous essential oil is methyl salicylate. So if you've ever had, I changed the order of my slides. So here's a woman. She was a 17-year-old. Ariel Newman is a 17-year-old athlete training for the Olympics. And she ended up accidentally overdosing on some kind of sport cream that contained wintergreen and basically dying from it, which is awful. And methyl salicylate is the main compound in oil of wintergreen. So when you have wintergreen candy or gum, methyl salicylate, which is related to aspirin. So if you look at that, salicylic acid or salicylate is what's found in aspirin, and then they'll add an acetyl group to it to make it acetyl salicylic acid. In this case, instead of having an acetyl group, there's a methyl group stuck on the carboxylic acid, and that increases the absorption through the skin by adding that little methyl group, and also changes the smell of it. So wintergreen or methyl salicylate belongs to the group of compounds that are called salicylates. So it has a nice winter green smell. It binds to cold receptors in the skin and has a bit of a nice cooling effect. It has an anti-inflammatory effect. So it's a good compound. However, in high amounts, it can cause basically, it's like getting overdose from taking too much aspirin. So causes nausea, digestive issues, ringing in the ears, it starts messing up your respiration. I think it causes metabolic acidosis, causes headache, confusion, delusions, coma, and even death. And so 4 mils of the essential oil is enough to cause harm or death in kids. And appreciate, like the case I just showed you before that, if you apply it topically, even though you're not taking the pure essential oil, if you were going through a bottle, a big bottle of that per day or a couple of bottles a day, maybe that might be enough to cause serious side effect or death in susceptible individuals. Now, just as an aside, some people have natural salicylate sensitivities and they can't consume foods that contain these compounds because they have an allergic reaction to it. So that would also apply to these products. Ray's syndrome is something you have to be careful of, where it's a weird kind of condition where you're not supposed to give aspirin to children, and because it can induce Ray's syndrome. And I would think that applying sport creams to kids may not be a good idea either. And then finally, these compounds can cause chemical burns. So salicylic acid is sometimes used for treating warts. So applying it too much topically could be irritating to the skin and not be good for you. Okay, so watch out for oil of wintergreen. When it comes to liver problems, there are a number of things that we know can cause liver problems from the herb world. So hepatotoxic herbs have the potential to damage the liver and cause like a drug-induced hepatitis. Now, there have been case reports of the following herbs having causing hepatotoxicity. So black cohosh, which I don't think is a black cohosh. I think it's an adulterant, but I'm mentioning it anyways. Greater celandine. There's a whole bunch of case reports of this happening. They do use greater celandine, which I often call just chelidonium, in Europe. So there's published PubMed results. It's a cousin of golden seal and barberry. It's a great bitter herb. It's a great antispasmodic herb. It's a cousin of the opium poppy, so it has some analgesic and antispasmodic effects. But I don't give it daily in general, just because of my concern that there could be some susceptible people out there who may not do well with it. Comfrey, I think I mentioned before, Health Canada warns against this. Sassafras, another thing, and then kava, which we've discussed. And so there are a few different types of compounds that could cause hepatotoxicity. Pyrrolizidine alkaloids, that would be in the comfrey, would be the big one. Isoquinoline alkaloids, I'm wondering if some of those compounds in greater celandine and black cohosh may pose some risks. Bloodroot's another herb that contains isoquinoline alkaloids that's usually used topically for warts. I wouldn't be surprised if it's not good if you ingest too much of it internally. And then some of the essential oils that we discussed already have potential to damage the liver. So one thing, if you look at the essential oils, as I mentioned earlier, the ones that have the phenylpropenes that have the double bond at the very end of that 3-carbon side chain, they seem to be the most hepatotoxic. So saffrol comes from a tree. It's actually in the cinnamon family. It's a very kind of a neat looking leaf. I took this picture in Hyde Park in Toronto. There's lots of sassafras trees there. If you see one, grab a leaf, crush it up in your hand and smell it. It's nice and aromatic, has some beautiful essential oils in it. Saffrol, just as an aside, it's also sassafras in general. Saffrol is often extracted and is used as a precursor to make MDMA, ecstasy. And so trees around the world, including in the tropics, there's a number of sassafras trees, are often harvested by the illegal drug trade because it's easy to add a few little carbons onto this to make MDMA. Just that's an interesting side note. Now, saffrol itself used to be a component in soft drinks like root beer, and has a pleasant taste to it. The problem is that if you drink too many root beers, you end up getting liver cancer, and that's because of the saffrol really messes up the liver. So even taking less than a teaspoon of the pure essential oil can cause liver failure. So this is no longer permitted to be added to food or to drink. So you can't find that. Now, other phenylpropenes that have a similar structure that appear to have some hepatotoxicity effects have been shown to cause issues in small studies. These might be an issue as well. Now, apiol is found in parsley and celery. Now, I get patients eat celery all the time. Parsley, I'm not overly concerned, but the pure essential oil from those two could be problematic. Now, the thing with celery is there's flavonoids like apigenin that have been shown to lower the risk for cancer. I really don't think eating a couple stalks of celery a day is going to have a high enough amount of this compound to lead to liver cancer. If anything, it's going to have a protective effect. And but appreciate celery seed oil or parsley oil would be potentially quite toxic. Eugenol, this is found primarily in clove oil. We know clove oil is toxic. Dentists used to use clove oil topically as a topical analgesic for toothaches. Cinnamon and holy basil also contain this. Holy basil is a great herb for cancer. That some people recommend for cancer. There are other anti-cancer components in it, so I don't think that's too much of an issue. So holy basil, also basil has some eugenol in it as well. Certainly eating I love basil, so I'm not really concerned about that. But again, the pure essential oils is another issue. And remember, cinnamon, deutenol and another compound called coumarin in cinnamon may have some issues for the liver. So it could be a combination of a couple compounds. Myristicin is another compound. This is found in nutmeg. Again, nutmeg oil you want to watch out for as well. Okay. Now, just as an aside, this is a little bit blurry here. Eugenol and some of these other phenylpropines, they get metabolized in the liver by sulfation and glucuronidation and by the addition of glutathione. So all three of those make these guys more water soluble. So you can, if you had some kind of sulfur containing compound on there or a sugar, then you can excrete it easier. Now, the antidote for clove oil poisoning. So if you happen to ever in your life, someone calls you and said, my child just drank a bottle of clove oil, what should I do? I'd probably tell them to go to emergency and maybe get them to take some NAC, which is the amino acid cysteine, which is also the antidote for Tylenol poisoning. Now, coumarins, I mentioned it just a couple seconds ago. Coumarins are also compounds that appear to have hepatotoxicity. So we know that, for example, there's a number of herbs that contain them. Historically, they're used as anticoagulants. Chinese cinnamon, which is cinnamon cassia, is different than true cinnamon, which is Ceylon cinnamon, which is the species is different. It's verum. Verum or Sri Lankan cinnamon appears to have lower amounts of coumarin in it, and so might be safer to take long term. So there are case reports in countries like Denmark where people consume a lot of cinnamon and cinnamon buns and products that there was a rise in liver issues. I'm sure the cinnamon buns themselves, probably the sugar is not good for the liver, but it appears that the Chinese cinnamon or some of the other, I mean, cinnamon grows in Malaysia and Indonesia and other countries as well. So depending on the species they're growing, some of them might be more hepatotoxic, but Sri Lankan cinnamon appears to be much safer. So I would be inclined to recommend Ceylon cinnamon to patients if they're consuming it on a daily basis for like diabetes or something where they're trying to get medicinal benefits from it, and limit the Chinese cinnamon to just like Christmas baking once in a while and things like that. And here's some studies that are emerging talking about the heavy cassia consumers. The other group of compounds are the pure lizidine alkaloids. As I mentioned earlier, comfrey is used by traditional herbalists internally for a variety of conditions like stomach ulcers. It's also used externally for fractures and burns and things. The problem is that it contains pure lizidine alkaloids. These compounds appear to be an issue when taken in high amounts or relatively high amounts, or just chronically even in low amounts. It could end up resulting in increased risk of liver cancer. Acutely in high amounts could cause liver failure. So this is why Health Canada has banned it. Now, the crazy thing, though, is when it comes to pure lizidine alkaloids, is there's different types. There are saturated pure lizidine alkaloids that don't appear to have the same toxicity as these unsaturated pure lizidine alkaloids. So this little double bond here needs to be present in order to have that negative effect on the liver. So there are lots of plants that contain pure lizidine alkaloids that are used medicinally by people. So World Health Organization says there's at least 60 different medicinal plants that contain these things that are consumed orally, like coltsfoot, butterbur, even echinacea has some pure lizidine alkaloids, but it may not be sufficient enough to cause a problem. The German Commission, they recommend getting less than 10 micrograms per day of these compounds for no more than 4 to 6 weeks. That seems to be a pretty good little recommendation. The interesting thing is coltsfoot, which is used for coughs and dry cough primarily, a lot of the recommended doses will have greater than that amount. So even coltsfoot, which has not been banned, maybe it should be banned, so for internal use. Or preparations, you can easily remove these alkaloids and then you wouldn't even have to worry about it. So Um, with regards to allergic reactions, poison ivy, this is a type of allergic reaction. It's called a type 3 hypersensitivity. And what ends up happening is resins, certain resins, and also sesquiterpene lactones, what can happen is they can form a complex with proteins in your skin that then stimulates a type 3 immune reaction, where the first exposure you might have a minimal reaction to it, but then your second exposure produces some pretty serious inflammation and blisters. So this is what a pretty nasty looking reaction to the urushiol, which is found in the poison ivy. Now, what's interesting is the Anacardiaceae family is the same family that has poison ivy, and it also has some other important plants like cashews and mango. And the Asteraceae family is another one. So if you look here, Anacardiaceae family, cashew fruit, mangoes, poison ivy, poison sumac. And there is some people who are sensitive to poison ivy will find, if you ever look at a mango, there's like a little sap that comes sometimes near the stem. There's a resin there. Some people will react to that as well. Because not everyone reacts to poison ivy, but some people severely react to it. And some people, I've been exposed to, I don't know how many times, and knock on wood, I haven't got a reaction to it. While other people just, walk through it once and that's it, they're in trouble. So watch out for those types of things, the cashew fruit. So in the Amazon, this is what the cashew fruit looks like. So down there, they eat the actual fruit, and then they throw away that little top thing there as the cashew seed. They throw that part away. And up in Canada, we don't eat the fruit, but we get the seeds, and then we roast them. The Asteraceae family contains a number of herbs that have been used topically for a number of skin conditions. So arnica, chamomile, feverfew, yarrow, elecampane, about half of those plants mentioned there are used topically for skin conditions, including eczema, dermatitis, burns, and things like that, bruises. But in rare cases, people will develop a contact dermatitis, and it can be a little bit like the poison ivy one. And that's because these herbs contain sesquiterpene lactones that can also form these haptens and cause a skin condition to it. Usually not as bad as poison ivy though. Now in practice, I don't think I've seen very many or heard very many reports of it. They do exist. It's a theoretical thing. I've seen maybe a couple people have a reaction to it, but not very many. And it's not too bad. So you see the guys later on. Now, phytophotodermatitis is not something you need to worry too much about, because most of the time your patients aren't going to have this reaction to the products you recommend, because most of these reactions occur when you're out gathering these herbs. So this is my hand. Here's an example of phytophotodermatitis. I was picking a bunch of prickly ash, and it got the resin on my skin, and I remember smelling them at the time, thinking, oh, it smells like grapefruit. I wonder if it contains furanocoumarins. And what do you know? It did. And I got bad blisters. So there's a number of families. So the Rutaceae family is the grapefruit family. So the oils in grapefruit, and also in rue, which is a garden spice, and a number of members of the Apiaceae family. This is wild parsnip. There's another plant called giant hogweed that looks like that, but it's about 5 times or 10 times the size. What happens is the furanocoumarins in the essential oil, if you get it in contact with your skin, it's benign unless you go out in the sunlight and get exposed to UV light. And under those circumstances, the UV radiation is concentrated on these furanocoumarins, and it generates free radicals that causes pretty significant blisters, and then causes your skin to become hyperpigmented, and that gives you a nice little tan where the blisters were, but it increases your risk of cancer. So there's a few different varieties of plants that have that. Like I said, this is only an issue if you get exposed to it, to these resins on your skin, and then you go and stand in the sunlight. If you were to, I've heard people, these wild parsnip, I used to get those blisters all the time on my legs. I never understood what it was until I realized that I was walking through these and doing like yard work and whippersnippering with around these plants. I was getting the succus from and all those oils, and the sap was just being sprayed all over my legs, and then it was causing burns. Cyanogenic glycosides. These are plants that contain cyanide-like compounds. And so cyanide, the reason why it's so toxic is it basically inhibits mitochondrial function, and it produces basically suppresses nerve function. So people who overdose on cyanide or get cyanide gas poisoning, they'll have difficulties walking, they'll become paralyzed, and then it basically end up getting cardiac failure and death. Also, these cyanogenic glycosides often will interfere with iodine absorption. So in certain countries like Africa, people develop goiters from consuming high amounts of plants that contain these cyanogenic glycosides. Just as an aside, hydroxycobalamin may be something that can bind up the hydrogen cyanide and basically help to chelate it out and be used as an antidote for cyanide poisoning, which is kind of neat. Now, there's cases where you've probably seen cassava in the grocery store. It's used in the Caribbean and Africa as a starchy vegetable. Tapioca comes from it. It contains cyanogenic glycosides, some species higher amounts than other ones. Usually, traditionally, the root is cut up and then basically soaked overnight so that an enzyme called linolmerase will basically break down these cyanogenic glycosides to release the cyanide so that it evaporates off. But in certain situations, in some countries where maybe there's a famine and they start gathering cassava that's called the bitter cassava that has higher amounts of it, maybe not preparing it properly, you can end up getting basically this disease called konzo, which is a paralytic disease. Usually you don't hear about people getting it from herbs. There are some herbs, just as an aside, that contain these cyanogenic glycosides. Wild cherry bark is one of them that's used as a cough suppressant, so I'm not concerned about low dose of that. Also, if you eat, let's say, almonds, there's a or apple seeds and peach seeds, apricot seeds, they have a very distinctive like almond-like smell to it. Some animals like millipedes will produce cyanogenic glycosides. Have you ever seen those big millipedes in the Central America or in the tropics? If you pick them up and give them a good shake and then smell them, they have a smell like almonds, and that smell is basically cyanogenic glycosides. So that's why your teachers in public school said don't eat the apple seeds. They'll kill you, which is kind of true, but you'd have to eat a lot of them. Drug interactions. I think one of the things that we should be concerned about is looking at how drugs can interact with the herbs that we recommend and being little experts on this. There's not too many things you have to worry about. You got to worry about decreasing the absorption. We talked about that. Decreasing the efficacy of the drugs. We talked about that. Increasing toxicity. A couple of things we didn't discuss yet is some positive interactions. So we know that there are some herbs and supplements that can decrease the toxicity of certain medications. So combining ginseng with chemotherapy can help boost the immune system and decrease fatigue. And there's other examples where there can be a positive effect where if you take, let's say, turmeric along with an anti-inflammatory drug, it enhances the effects and maybe you can take less of it. Francis Brinker is a naturopath. I don't think he practiced, but he's written a number of great books on herbal drug interactions. I bought them. I think they're good to have on hand. Some of the interactions are theoretical. We don't know how relevant they are clinically, but it's worth having a copy of that. I don't have a lot of books that I refer to, but I do look at that one. I think it's a great one. A couple of drug interactions is worth mentioning. Antidepressant drugs, we know that there are some herbs that could interact with this. So, for example, rhodiola rosea, this is a herb that acts as a monoamine oxidase inhibitor. And so there's potential if you took that while being on antidepressants, that could be a problem. Also, taking St. John's wort with any of these antidepressants that target serotonin could be an issue. When you increase serotonin levels too much, you can end up getting serotonin syndrome, which is rare, and you might initially see some mood changes, but it can in serious situations, it could increase the risk of death, which is rare. I don't think I've heard it happen too often, if at all. But the main thing is if you overdose, you're going to start to overheat. You're going to feel ecstatic. You're going to probably get nausea, vomiting, diarrhea. There's going to be changes of blood pressure, dehydration, overheating, things like that. Okay. So these are both great herbs. Just caution combining them. The other big thing I'd worry about is blood thinners. And so there are a number of herbs that could potentially interact with blood thinners. And so certain herbs could potentially increase the risk of bleeding. We know that things like garlic and ginger, ginkgo, feverfew, willow bark, dong quai, they all have blood thinning properties to them. So there may be some health benefits of consuming garlic or ginger on a daily basis for making the blood a little thinner, which could be good. When you look at the research coming out on aspirin, it appears that aspirin, it might lower your risk for getting a heart attack, but they're not recommending it to the average person taking the daily dose of aspirin because it appears to be too much of a risk for causing internal bleeding and stuff. But the beautiful thing with something like garlic or ginger is it could still thin your blood without having that negative effect on stomach ulcers. So those are some areas that if someone's on, let's say, Coumadin, which is the blood thinner, it's given to people who are at risk of having a heart attack or stroke in some cases. You have to be very careful about what medications you take along with it. So these drugs could increase the risk. We know that some things like, for example, the herb ginseng might decrease the efficacy of warfarin. It might increase clotting factors, just like vitamin K does, and St. John's wort may interact not because it thins blood itself, but rather it could increase the metabolism of Coumadin. So just a few things to be cautious about there. You don't need to know this, but I think this is kind of neat. This is one of the whole pathways for the clotting pathways in the body. And you can see different herbs target different steps in this whole process, which is just kind of neat. I just like knowing where herbs are working. So I've just kind of pieced that together for us. Willow bark contains salicylic acid, blood thinner. Garlic, again, blood thinner. Skipping over that. Miscellaneous concerns. There's a Chinese patent in Japan called minor bupleurum formula, or Sho Sako To. It's great for hepatitis C, but you can't combine that when someone's on interferon because it causes inflammation of the lungs. It can be pretty serious. So just a side note there. And then a couple last things. Pregnancy. There are a number of things, actions related to pregnancy you should be aware of. Teratogen is a substance that basically damages the fetus. In Latin, terato means monster, genesis means to create. So teratogen means you're making little monsters, basically. And that's these compounds seem to interact with cell replication and cause problems. An abortifacient could be a teratogen. It basically terminates the pregnancy. It may also work by other mechanisms, like it could stimulate a uterine contraction. So an emmenagogue is a substance that basically stimulates the uterus. And then another term, parturient or partus preparatus, is a good thing that's usually given to women to help prepare the uterus for childbirth and delivery. The thing is, some of these herbs are useful at the beginning of the pregnancy, but not at the end of the pregnancy. So one of my colleagues is a naturopath. He and I used to carpool every day together, Jean-Jacques Dugois. He did his PhD on herbal safety and pregnancy, and he wrote a book, which he doesn't actually recommend you buy because it's too expensive. And I've just summarized one of the things that I liked from his book. And basically, here's a list of herbs that have been established to be safe according to the research that they looked at. So things like cranberry, echinacea, garlic, ginseng, milk thistle, you can read all those yourself. These look like they're safe to give. So if someone, let's say if a woman had a urinary tract infection, I'd feel comfortable giving cranberry. If they had an infection of some sort, I could give garlic. If they're feeling nauseous, I could give them ginger for morning sickness. If they have varicosities, you could use something like horse chestnut. Raspberry to help the uterine tonic. Senna, you could give them for acute constipation if you wanted to. St. John's wort, if they had depression, that could be safe. And then turmeric for whatever reason. There's a couple things like Korean ginseng and ginseng that could be used as for energy if they really needed it. So anyways, safe herbs, that's good to know. Unsafe things, you don't need to memorize any of these. I'm just letting you know that we know a little bit about this. Aconite, no surprise there. You know, I probably would not give aconite to a pregnant woman. You know, another thing, deadly nightshade. Oh, no, not deadly nightshade here. Coffee, safe to give some. So you can have a little bit of coffee when you're pregnant. Just don't go and have 5 or 10 cups a day. Fennel, that one you got to watch out for. A little bit of fennel's fine, but because of the estrogenic and hormonal effects, you got to watch out for that. Flax, again, caution. A little bit of flax in your diet is not going to be bad. Too much isn't a good idea. Licorice can actually stimulate uterine contractions. So small amounts here and there probably wouldn't be a big deal, but I wouldn't give a lot of that to a woman. Nettle, they say caution. I don't know why they say caution for that one. Maybe hormonal effects. Often naturopaths and herbals will recommend nettle tea as a tonic during pregnancy as well. Finally, the things that you must stay clear of are the unsafe ones. So anything that contains isoquinoline alkaloids, I'd say no way. These are teratogenic. So that's golden seal, barberry, Oregon grape. That would also include chelidonium, bloodroot, coptis. I would include in that list. Borage, the herb, contains pure lysine alkaloids. A number of herbs with toxic essential oils you want to stay clear of. So parsley is on that list as well. It's an emmenagogue. It stimulates uterine contractions and has been used as a abortifacient. I don't think a little bit of parsley in your tabbouleh is going to be an issue, but if you were to take high amounts of it or the pure essential oil, definitely not a good idea. Don't drink too much gin when you're pregnant as well. I would say anything that starts with deadly, don't give it to a pregnant woman. Like deadly nightshade, don't want to give them that. Ephedra, you got to be careful. That would be unsafe as well. Foxglove, yes. Blue cohosh is a herb. The reason why that's kind of one of the more important ones is that historically, some naturopaths and herbalists will give blue cohosh as a preparatum, as a parturient herb to help with the childbirth, but there have been a number of case reports of blue cohosh causing complications and issues with the heart and everything. So I don't think we should be using that because it's been established to be harmful in a lot of sources. And so the concern is, let's say if a pregnant woman came in, you gave them blue cohosh, you didn't explain to them the risks associated with it, and they weren't a high risk person, and they took it and there was some complication, I could see that being a lawsuit. People get a little bit, they freak out when it comes to pregnancy, and they don't like it when you hurt their baby. So watch out for blue cohosh. I know some naturopaths do recommend it, and I just caution that. If not for the patient's, if not for the baby's sake, for your own sake, just be careful about that, because I don't want you getting sued or giving naturopaths a bad reputation. Okay. There's my daughter. That was a few years ago. She's cute. That's when she was first born. So in my opinion, when it comes to pregnancy and lactation, when in doubt, don't give it. Just only give things you know are safe. Sometimes things like blue cohosh that were traditionally used for pregnancy have case reports of causing harm, so avoid those ones too. I would say you don't need to know every single herb that I mentioned. I think you should know that what classes of phytochemicals you need to avoid. And what's good about this is alkaloids, all you have to do is remember that anything that contains an alkaloid, chances are it's probably not good for you if you're pregnant. You know, maybe a little bit might be okay, like in the case of like purine alkaloids in coffee and tea, you can do a little bit, but most of the alkaloids you got to watch out for, okay? So that's an easy way to remember. Essential oils, I think that's pretty easy to remember too, that Some of those are toxic. You got to watch out for those when you're pregnant. Some of them might be okay, but caution with that. And then the cardiac glycosides, obviously anything that's affecting your heart, you don't want to mess around with. So sorry I went over a little bit, but I just wanted to have that lecture completed. I'll get this posted in a couple days for you guys. Which if you're watching the recording, that's a little bit, doesn't really matter that I say that. Anyways, you guys have a great week. And just remember, next week, we're going to have no live lecture. I will post the lecture in advance because I'm going to go on a little much deserved holiday. Okay? You guys have a great week, and we'll see you soon. Bye for now.